Hello and welcome to EuroPCR 2024. I'm Chris Cook and I'm delighted to be joined here in the studio with William Wijns and Niek Klazinga. Welcome, gentlemen. And here we're going to be talking about the RESIL Card initiative. So let's kick off, William. And my first question to you is, what is the RESIL Card initiative and where did it originate from?
Thank you, Chris. Well, we can start with the tagline, strengthening cardiovascular care resilience for healthier hearts. It's EU funded. It stems out of We Care with a strong consortium, and where we originated from is the disruption of cardiovascular care during COVID, with all the consequences. Reducing the number of procedures, increased mortality, morbidity, but on the positive side, we've also learned a lot out of this dreadful experience. We want to capitalize on the experience from the field, healthcare professionals, to actually build a test that would help people to find out whether they are prepared to face the next crisis. So that's, in the essence, RESIL Card.
Fantastic. Very, very important initiatives. And taking the positives from what was a very, very difficult time for our patients. Okay, Niek, so can you tell us what is the progress to date with the RESIL Card initiative?
No, happy to, and it's a pleasure to be here and representing a research group at the Amsterdam University Medical Center that is not an expert in cardiology, but in health services research. Our group does a lot of research on resilience in all ways in healthcare systems. And so far for the RESIL Card, we have been communicating with a lot of people in your community and collecting, of course, the literature, but we're also conducting a survey. And that's a very important element. It was launched a week ago, and we really hope that the PCR community will fill in that survey, because that's a structured way of sharing your experiences. Because we hope what your experiences were with workforce changes, with data limitations, with technology shortages, but also the behavioral parts of dealing with stress. And so it's all in the survey. But it's important that the PCR community who are invited fill in the survey, because we will use that for focus groups in countries with representatives of your community to build the tool that William says, to have something that will help you prepare for future crises and to strengthen. And the word resilience is, of course, a kind of modern word, but it basically means that you know how to respond and that you're prepared for challenges that you are faced by that come from outside.
Thank you. That's really clear. So there's a call to action here from the PCR community. All right. And so final question now to you, William. How might the learnings from the RESIL Card initiative be applied to other crises that we may face in the future?
Yes. Well, we're actually trying to prevent removal of life-saving care. And that can be challenged by many crises, whether it's infectious disease, any sort of climate issue, you name it. We think that this test and this preparedness test will help facing any of those. And it's going to be distributed from the three consortium members, Amsterdam University with Niek, GISE in Italy, and CatSalut in Catalonia, to all European countries in order to really prevent removal of life-saving care in the cardiovascular field.
All right, well, gentlemen, thank you both for doing this very important initiative. And thank you very much for watching as well. You've heard the call to action. Please fill out your survey if you receive one to allow us to better plan to tackle crises in the future.